So when checking for the patient's cardiovascular system, when inspecting, looking at main areas, for example, beats on the jugular vein, carotid, or apex of the heart, no changes were visible. There is no disturbance. When checking for palpation, we check the jugular vein, carotid arteries, and peripheral veins as well to check for pulse. The patient presents weak pulse, tachycardia. When percussing the heart shadow, the cardiac shadow was normal, and when doing auscultation, we could see symmetry between both. All peripheral vessels were also symmetrical regarding the pulse, and when we did auscultation, the patient presented symmetry in peripheral veins and the heart, and there is no murmurs, no difference, or no arrhythmias checked in the heart when did auscultation. In summary, we can see cardiovascular dysfunction because we can see weak pulse, most probably due to hypovolemia. We could see tachycardia, and we could see low blood pressure. Okay, so when looking for the schema of the heart to understand what happened with the patient, here we have the schema of the heart. So we have right atrium, right ventricle, left atrium, left ventricle. We can see here pulmonary vein, pulmonary artery. We can see aorta and vena cava. So, and then we can see the valves here. So mainly what happens is that because the patient presents symptoms of peritonitis and you have bacteria in the abdominal area, you do have toxemia, which means that you have liberation of toxin in the bloodstream, and because of that, the blood will eventually reach the heart, and because of that, you have what is called third space sequestration fluid, which means that you have, because of the toxemia, you have increased permeability of the vessels, and so you have fluid coming inside the vessel towards the outside of the vessel. Regarding treatment, no specific intervention in the cardiovascular system is needed because once we administrate antibiotics to the patient, the respiratory tract will eventually go back to normal, which will reduce tachycardia, for example, and symptoms of hypoxia. And then you will have normalization of cardiac symptoms as well. And the only thing that is necessary is to recheck any signs, any vital signs regarding cardiac system in the patient from hour to hour.